Okay, we're going to try and do Dr. KEKUNNAYA's video, then we can come.
Okay. How many of you have seen a very large esotropia like that? Looking at the medial wall. It's not abducting. Just music will change. That time you'll realize what has happened. Just listen to the music. Very, very large. By birth, she was a teacher. She wanted her eyes to be fixed. Lens is looking at there. So, tight medial rectus. I'm telling my fellow it's going to be very tight. Helping me. More help. So just took some step, paused and got hold on to the medial rectus there. Suture, things became alright. First thing, don't panic. That's the most important. So we could still insert 8 millimeter behind. We could still go ahead with the plan. This is the medial rectus resection. And second thing I wanted to do is superior rectus and lateral rectus loop myopexy, because this was a convergent strabismus myopic fix, not myopic, non-myopic fixes. So it's there by birth. It's a very rare variety. And she wants to go to school because people are making fun of her. That's where the problem is. And sometimes the most important cases, something like this happens. So we did this loop myopexy what Dr. Matalia showed. So joining both of them, and then you can see this is the outcome what she had at the end of this surgery. So she's happy. So sometimes I think don't panic. It's the most important thing, especially when you lose the muscle. Got to hold on to that muscle part, and then we did it. If you have time, I'll show one more video.
Go ahead.
Yeah.
So this is sometimes you will see in kids, you know, popping of this eyes. It's not very common, especially when the child is lying down, especially Indian babies, they like to look at the fan on the wall. So when they lie down, you can see this bobbing movement. Can you see? Most of the times you cannot elicit in the clinic. Downward movement, it happens maybe 5 to 10 times in a day. And if you want to do it in the clinic, you have to pick up the baby and then lift it. You can still elicit it. So this is the benign paroxysmal down gaze of infancy. Obviously, we'll do all the workup, but it's a very benign condition. It goes off within maybe 6 to 8 months. Why it happens? It happens because of the maturational delay of the nerves supplying this, so, and also the brain. So this is a benign condition, but this needs to be re-emphasized, and you have to do the counseling accordingly. And probably I'll show the last one video. This is something you can use it in your own clinical practice when you're doing cataract surgery, especially when you have a total cataract. You can look at the posterior pole, just either putting in the air in the antechamber or adjusting the microscope. You don't have to get the sterile indirect, and posterior pole, you can look at it very, very clearly. So this we call it as peekaboo sign. It's very, very useful. You know, you don't have to see on the first post-operative day, you know, crying baby, all that. And you can give prognostication looking at the posterior pole. Thank you very much.